I started as a social worker. I was a young, naive, straight from college, thinking I could fix the world. A year and a half in, burnt out. But what I saw in that role was the role of nurses. And I was like, hold on. And I really felt just called to be a nurse. As soon as I understood what nursing did, I started paying attention to people making decisions at my kids' school district, at our state level, at the federal level. And I really didn't see a ton of evidence-based decision making the way I see it in the hospital. And it just clicked that there should be a nurse sitting at all these tables. And then my state representative seat for the district I live in, the person who had been in it for 8 years had just term limited out. So there was going to be an open seat. So I just stuck my name in.
Wow.
And won.
That's amazing.
And at my party, I Googled, what does a state rep do? Ever since this, I've been like, every nurse I can talk to, I'm telling them they have to get involved in politics. They don't have to run for an office, but they have to advocate it. Policies being decided that impact health. So I would say all nurses are an expert. Sometimes we're good at saying, I'm just a nurse. And I push back, yes, you're just a nurse. So stand up there and, we're not just anything. We have so much knowledge.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time.
Hi, everyone. Welcome back to the Nurse on Purpose podcast. And today we are joined by an incredibly special guest whose work bridges the worlds of nursing, advocacy, research, and policy. Dr. Rachel Baker is a PhD prepared nurse with a background in pediatric nursing, a court-appointed child advocate, and a dedicated nurse researcher. In her professional role, Dr. Baker leads a nursing research and evidence-based practice program for a large hospital system in Cincinnati, Ohio. She also shares her expertise as an adjunct professor teaching research and biostatistics to graduate
serve
nursing
as a state
students.
representative in the Ohio General Assembly.
Her impact
In her
doesn't
first
stop there, guys. She is also a state representative in the Ohio General Assembly, where she has championed legislation on healthcare workplace safety, prescription drug costs, adoption reform, substance use disorder care, and much more. As ranking member of the House Medicaid Committee and a member of key health and finance committees, Dr. Baker is actively shaping policies that impact nurses, patients, and communities. It gives me great honor to welcome Dr. Baker to the podcast. You're welcome.
Thank you so much. I'm so excited to be here.
Awesome. Thank you for being here. It's such a pleasure. And this is the first of what I hope will be many more interactions with a member of Congress who is also a nurse, because I think you represent that quintessential picture of advocacy, and you're at the helm of shaping policies that impact nurses and communities. So I'm really excited. So today's episode, we're going to dive into your nursing journey so far, how you have managed to successfully intersect nursing and policymaking, and really just talk about all the work that you're doing to create real change in healthcare. So let's get started talking about your journey. Take us back to the basics, Representative Baker, because I'm gonna go back and forth between Representative and Dr. Baker, just because I'm starstruck and I have to brag on you a little bit. So take us back to that journey, nursing. How did you end up becoming a nurse?
So it took a while to figure out what I wanted to do, and I still don't know. As you can see, I keep taking on new roles. But I started as a social worker and did pediatric social work, medical social work, and really, unfortunately, burnt out super young. I was a young, naive, straight from college, thinking I could fix the world. Social worker, working with kids with oncology unit with kids with cancer. and that's a hard population. And immediately a year and a half in, burnt out. But what I saw in that role was the role of nurses. And I was like, hold on. And I really felt just called to be a nurse. As soon as I understood what nursing did, it was so much more than I don't have nurses in my family. Interestingly, for your podcast, I kind of just had the media portrayal of nurses, and I never thought I would want to go into it until I saw what they actually did. And I saw that the rapport that I wanted with clients in social work, nurses had with patients, but they also had a science side, and they also had a side of like getting things done, so I could build this rapport, I could help my patients, but I could also get that infusion done. I felt like there was some progress being made. So switched over and got my BSN in nursing.
That's wonderful. That's awesome. And then I guess you pursued further to obtaining your PhD. What made you go that route?
So I worked for a while as a direct care nurse, loved it. But I'm also a lifelong learner, like lots of us nurses are. And so I was always looking for the next thing, and stayed at the bedside. And the unit that I worked on, I was really into endocrine disorders and new onset diabetes, which is what I always suggest new nurses think about going into. We can talk about that too, but it's such a great field for new nurses to get all your skills. Because those newly diagnosed type 1 diabetes families, that first day, sometimes they're really sick ICU level care with insulin drips and titrating things and very intense care, more scientific care. Then day 2 is usually a psychosocial day. They are not as acutely ill, but the family, everyone's realizing we have a chronic disease now. So you get to do a lot of the psychosocial support. And then the third day, and this is 20 years ago, so maybe things have sped up, but the third day used to be education and empowerment and teaching the family and teaching the patient, you can do this. This is a lifelong thing, but it's a lifelong thing that you can live a long, happy life if you do it right and if you learn it. And just watching people go in those 3 days from so sick to so sad to feeling empowered and like they own this disease, it doesn't own them, and they are going to do it the right way. It just is. It shaped my view of nursing, and nurses led that 3-day transition. And I just love that field. But that was where I started my career. And we didn't have enough kids newly diagnosed with type 1 diabetes to be on their own unit. So the unit was shared with our hospital's inpatient research patients. So those patients would be from all different disciplines. When researchers had a patient that needed an overnight inpatient stay for the study, so really rare diagnoses, and we're doing infusions of new medications, or we're doing biopsies, and they needed to stay. And so those patients on the unit, I got to see all these things you only read about in nursing books, that there's 4 people in the world with this thing, and I saw them and I met them. And I just, as I got more comfortable in my practice, I didn't need the routineness of the endocrine patients. I love the challenge of a new research patient and no one knows what this is. And I really fell in love with the research side of nursing and went back and got my PhD.
That's wonderful.
Yeah.
That's amazing. And when we had spoken before, you mentioned that people encouraged you to become a physician instead of a nurse. What was your response to that? You've talked about why you felt, called and drawn to nursing, but what was your response to that idea?
Yeah, I have physicians in my family, and so when I thought about going into medicine, or healthcare, that medicine is kind of what I thought. And I wasn't really drawn to that. And I just see nursing as once I saw it, once I was at the hospital and saw what nurses did, I realized that nurses really took care of the whole person, and not just diagnosing and prescribing, but explaining, spending the time at the bedside to build a relationship and rapport so that the patients can hear what you're saying, translating what the physicians are telling them into like, what does this actually mean in the real world, and being approachable. I can't tell you the number of patients that after their physician walked out of the room, they'd be like, okay, what does any of that mean? And no, I mean, there's wonderful, amazing physicians in the world.
Of course. Yes.
But I think, nurses don't have the implicit power thing going on where people feel intimidated. I think doctors have to work hard to build that rapport. Nurses, everybody likes the nurse, and so, and you spend so much time with your patients. And so I never really considered it until I was right there in the hospital as a social worker, seeing the role of nurses. And I was like, this is what I want to do. I thought it was a social worker, but it's this.
Yeah.
So being able to shine a light on nurses are not just following the orders of physicians. It's our own practice. And we have a really important practice, I think. And we're professional and we're smart and we're not less than a doctor, but we're our own profession.
Absolutely. Thank you for sharing and explaining that. Really, your passion for nursing shines through. And I think helping others to understand truly what nurses do is my mission. And I feel like we share the same passion and mission for nursing and helping people to see what we truly are about. And so I appreciate you, really digging in and explaining how it was by seeing it that you were inspired to become it. It wasn't just some abstract idea and you were like, oh, nursing sounds fine. I don't know, like I'll just pick something. You were actually in the trenches and what they did attracted you to the profession. So wonderful to hear that. All right, let's transition to your work in politics, right? What inspired you to kind of transition from nursing into politics? Of course, I know you're still in nursing, but did you always see policy work as part of your nursing career, or what was that turning point for you?
That's such a good question. So I'm hoping that my nurse policy instructors don't watch this. Nurse policy was my least favorite class.
Oh, no.
I was like, what are they talking about? I just want to be a nurse. What
I
is
love
this?
that they actually had that class for you.
Yeah.
That's
We had nursing policy or health policy class, and I hated it. And I was like, it was interesting, but I was like, I don't even know what they're talking. Like, I just want to go take care of patients. And so it's a little embarrassing to me that I spent so much time not understanding that. And really like scoping my view of nursing to like the bedside, which is
and making it more complex in your mind than it really was, right?
Yes.
It's like we talk about research. Like no nurse is like, we don't like nursing research. And then all of a sudden, all the nurses are in research and you're like, what happened? They're like, yeah, it's totally not what I made it up in my head to be. I'm sorry.
That's exactly it. That's exactly it. And so I always liked research, but I didn't like policy. I was like, research, I get, like we're learning what we're doing, but policy, I'm like, whatever, like this is just, So I took those classes that were required and moved on. And it really wasn't, I would say, until we lived through COVID that it was like shoved in my face that policy has such an impact on the health of communities. I think we're really good as a society, as a state, as a country in acute episodic care. You have a stroke and we can identify where that clot is and, we can do great care in emergencies. We're not so great at preventive, social determinants of health and promoting health from a health perspective. And if you think about that, that happens from policy, that happens from, what resources are in the community, that happens from education, that happens from housing, that happens from impacting racism and discrimination. I mean, there's so much gun prevention laws. There's so much that impacts the health of communities outside the hospital walls.
That's wonderful.
And that's really what nursing, let's think of like our founders. nurses were the face and the voice of public health through flu pandemics, through tons of things. And I don't want to speak negatively about the nurses that were involved in the COVID pandemic, but from my view of who I saw, it was really a physician-led response. And I wonder if society and community would have reacted differently if it was a nurse-led response, which I feel that we should have stepped right into that moment and led the community and how to respond to a pandemic. And instead, what I saw in that moment was nurses revert back to like following orders. And we were, I mean, understandably, many of us were very swamped at hospitals, and it's a lot. But I realized that nursing had moved a little bit from its public health but we have the trust, we have the respect of community. And so think of that survey that comes out every year where nurses are the number one trusted, ethical professional by the public, right? I think we were every year except for 9/11 when firefighters got it. So they deserved it that year, but we get it every other year. And so that's like a great honor, and people always post about it, but it's also an obligation. Like, we're in a public health crisis. We should have stepped into that space and taken over lead of communication and of explaining what was happening and reassuring the community and educating. So I started paying attention right then to people making decisions at my kids' school district, at our state level, at the federal level. And I really didn't see a ton of evidence-based decision-making the way I see it in the hospital. And it just clicked that there should be a nurse sitting at all these tables because we can translate, we can negotiate. So it was kind of seeing that, and being a nurse who runs into fires, I was like, and it was kind of a perfect storm because that happened. And then my state representative seat for the district I live in, the person who had been in it for 8 years had just term limited out. So there was going to be an open seat. So I just stuck my name in.
Wow.
And won.
That's amazing.
And then I've kind of learned it as I go.
Yeah. Where you're like, oh no, I didn't know I was going to win this. And like, now what do I do?
Yeah, the story I can only tell because now I've won 2 elections, so no one can use it against me.
Awesome.
Is that at I had a party the first night for all my volunteers. It was a packed party, and it was election night. We were watching election results come back, and I was so nervous. And you have no idea. There's no polling at like the state level. I mean, I could be winning by 10, I could be losing by 10. My seat had always been held by the other political party, so it was unlikely I was going to win just by history. And I got a call that they were about to call my race, and I won it. And it was the only state house seat in the state of Ohio that had switched political parties. And so they were telling me the media is going to call. And I was like, can you give me 5 minutes? And at my party, I Googled, what does a state rep do? And I would never admit to that if I was running, because they would use that clip in like, she doesn't know what she's doing. But now that I've been here a couple years now, I know what we do. But
that's wonderful. Yeah.
I knew that we needed nurses at decision-making tables, and I did kind of go into this blindly, but I knew that I would learn what I didn't know. I would ask questions and seek out resources, and that I would take this seriously, and that I would like really work to represent Ohioans well. So I didn't know what I was going to be doing, but I knew I would work hard and put my all in it and see if nurses can be impactful or not in this role. And so now, ever since this, I've been like, every nurse I can talk to, I'm telling them they have to get involved in politics. They don't have to run for an office, but they have to advocate it. This whole system works by people engaging and advocating. Yeah. And as we see people disengage, it's why we're spiraling out of control. So we need people to re-engage and to, make sure their voices are heard in decisions. So that's kind of been my mission now.
Yeah. And I can
demystify it all, and make it less intimidating.
Yes, exactly. Kind of socialize it, because we're not socialized to that idea yet. But I can see just how impactful you're getting involved in the community during COVID, teaching, allowing people to see that nurses can take the lead in public health and preventative medicine. And that had such a great impact, I'm sure, when you ran and people already built that trust in you. And so they knew, okay, she's going to do wonderful work if she takes office.
Well, that is the funny thing is as I acted like a nurse when I was running for office. I knocked on every door that I could knock on in my district. And,
Yeah.
it's like when you walk in a patient's room, you don't know what you're getting, but you can build a rapport quickly. You can find those
Right.
common grounds, find out what's important to people and build on it.
Yeah.
And, people were like, even people I think that had different political views than me were like, oh, but you're a nurse. Like
Yeah.
everybody likes it. They're like, my aunt's a nurse and she's so sweet. Like, so we can use
Yeah.
the trust that people have in
Yeah.
us.
Absolutely.
We talked about the survey where we're the most trusted professionals. One of the least trusted professionals is politicians. So
Oh
I
my
love
goodness.
being a nurse politician. No one knows if I'm good or bad.
We're intersecting good with bad.
I know.
But really making greatness out of it.
Yeah.
And and speaking up in healthcare policy, now you mentioned that nurses do need to get involved in advocacy one way or another. What are some practical ways that bedside nurses or any nurses can get involved in policymaking, like even if they don't want to run for office? What are some practical things they can do?
Yeah, a huge percentage of the legislation we do has health impact. I'd almost say everything does. Like I've sat in committees that are totally unrelated to health, and whatever we're talking about, I can make it a health priority. And I'll give you a quick example of that. My first term, I was placed on aviation and aerospace committee, and I'm like, oh, great, this is going to be fun.
I actually don't get to pick.
Yeah, I'm like, I know nothing about this, but then it was such a good experience because I realized this is how a lot of people feel in health committee. Like they don't know what we're talking about. It's not health professionals. So the same way that I was like, okay, explain to me those acronyms, I could serve that role in the health committee. So it did help me kind of see that everyone's not an expert on those committees.
Absolutely.
But we were talking about drone regulations and like unmanned Jetson kind of like transporting in the sky and making highways in the sky. And so people were talking about like Amazon deliveries and DoorDash and those coming all by drone. But I went to, you're with your friend hiking and they have an anaphylactic reaction. I could drone within a few seconds an EpiPen to you.
Wow.
Or there's a huge crash out in a rural part of Ohio. We could drone trauma equipment and a telehealth trauma surgeon to be talking with the first responders. I mean, the way we could use these technologies in a health way are really impactful. So we talked about droning organ donations across the state, like within minutes, So anything we talk about, I'm going to twist it around to figure out how to make communities healthy. So so there will absolutely be at your state level, at the federal level, even at your local school board level, policies being decided that impact health. So I would say all nurses are an expert. I think sometimes we're good at saying I'm just a nurse. And I don't know if that's, a more female dominated profession, but or just because we're kind of caring, serving others kind of people, but I hear that a lot. And I push back, yes, you're just a nurse. So stand up there and, like we are not just anything. Like we have so much knowledge. And so making sure that your voice is heard at all those policy levels. I think one of the easiest ways is to join your professional organization.
Absolutely.
Because they have lobbyists, they have government relations folks who track all the legislation that's going to impact your role. And usually their communications will say these kind of bills are being considered or these, just I think that's the easiest way to have somebody watching what's going on in your state and getting you the information and then testify. In Ohio, you can do written testimony where you email in a response, or you can come to the State House and testify in person, which is so much more impactful. We go into committees and I've had hundreds, even 1,000 pieces of emailed testimony. And I'm a type A nurse, so I'm reading all that. I cannot 100% guarantee all my colleagues are reading all of it. But if you stand in front of us in committee, even if some of my friends are playing on their phones, it is going in their ear. Like they have to hear what you're saying. So definitely, these are the people's houses. We're supposed to be taking up the spaces. The decisions are not supposed to be made in the dark of night with nobody watching. So I would encourage people to show up at their state house and be strong and brave and stand up and speak truth to power, because these are people making decisions, and we have people come and present all this data, all this stuff's going to happen if we change things. And then we'll have a nurse stand up and be like, let me tell you about my patient I took care of yesterday. This is what would happen if you did this. And that is so much more impactful. So being able to tell our real stories and how these laws will change our stories is one of the most important. And we're in a trusted profession to do that. We have the power to do that. We have to just get rid of our nerves about it and come in and do it, you know? So I'm always inviting nurses to come up to the State House, and I take them to committees and I show them without having to testify what it looks like to testify, so that when you're ready to do it, you're ready to do it, you know?
Amazing. Yeah. So what are some current healthcare or nursing related policies that you're working on, or, you know, are involved in some way that nurses should be paying attention to?
Yeah. So in Ohio, I have a handful of things. We've just started our 2-year legislative session. So everything's new. I had a ton last year. Several things got through. I think you mentioned them, but several things that didn't finish the process. So I'm restarting them over this General Assembly. So some things haven't been introduced yet. The things I'm working on that are getting introduced, we have, I'm really excited about. They're called prescribed pediatric extended care centers. And basically what they are medical daycares. So daycare centers that are a portion typically developing kids and a portion kids with complex medical needs. So vents, trachs, feeding tubes, things like that. And there's a early childhood education staff and a nursing staff there. So these are kids that often would get one-on-one nursing care at home. And so until school starts, that's really all they have as far as socialization. And so these PPEC centers, kids would be able to, if they choose to, would be able to come to preschool to daycare and have a typical experience like their siblings and like their peers. And there would be a nursing staff on staff that would support that. So it really, a lot of states have these. Ohio doesn't yet. So a great way, another option for kids with complex medical needs to get socialization and get some early childhood education and preparation before starting public education or private education. So that's a big one I'm working on. I've been working with some people last year and then again this year on a bill around supervision of certified registered nurse anesthetists. So increasing access to anesthesia care in Ohio. Yeah, what else am I working on?
That's amazing. It's kind of come full circle with, started as a pediatric nurse and now writing policies that help support, the care and management and advancement of health of a pediatric population. And that's
what's interesting. So I live in Cincinnati, which is right on the river with Kentucky. And we have a lot of families that'll move to Cincinnati for our children's hospital. If they have a kid with lots of complex medical needs and need lots of specialists, they'll move there. But they live over on the Kentucky side because Kentucky has medical daycare. So so then they can get to the hospital, but they also have a community that supports their medically complex kids. And it's, being now a representative in Ohio, I'm like, we need to have not just great healthcare systems to help these kids, but we need a community that gives them options for their social and emotional and developmental success. So really looking at social determinants of health and making sure that we're, from a policy level, supporting people to live their healthy lives.
Wonderful. Thank you so much. Now, you've talked about at the beginning of our conversation how nurses were largely absent from public health discussions during COVID-19. Can I ask you, what do you think a healthcare system that was led by empowered nurses look like to you?
Oh my gosh, I would love it. I think, and I work with tons of doctors I love, and I think it's just a different view. And it's such a holistic patient-centered view. And there's really good nurses, I think, that can see that whole picture, and having us step not away from the bedside, but step in addition to the bedside to leadership, whether that's public policy leadership, whether that's doing research leadership, whether that's leading a healthcare system leadership. We have skills that I think would really advance healthcare delivery, advance healthcare experience. And it's just so interesting as my career has progressed and I've watched that I think we have the skills, we have the trust and ability. We just have to take it. And so many of us do not feel empowered to take it, or do not feel like I shouldn't do that, and it goes back to your media portrayal of nurses. And I feel like we are just socialized that that's not our role, and it's actually our role,
Absolutely.
And we have the skills, the knowledge, and the trust from the public to do it. Like, we have everything. It's us. We just have to do it. And I've seen that in this role and in doing it in the policy world. I've been able to be successful. I'm in the super minority, so not a lot of political power here. And I had 4 bills passed. I think I'm the only freshman for sure, but maybe only person in our caucus that's had that much. Wow. And it's from working across the aisle. It's from using my skills, assessing the situation, building rapport with people. We all take care of patients that think really different than us. We can be professional, build rapport, find what's important to them. That's all it is. I mean, it's the skills we know how to do, and the policy you learn, the law you learn. Those skills you don't learn. Those are what we have as nurses. And
it's what we're already doing every day. We're teaching our patients, right?
Yes.
We're helping them to prevent future disease and to prevent return to the hospital.
Yes.
We are helping them to decode the medical jargon that, they obviously don't understand. We're always there by their bedside, doing the things that may seem mundane, but actually lead to higher rates of recovery. We often tend to diminish our experiences and our skills. And I think, there's that research that talks about how women will have 80% and feel like they're not good enough to apply to the job or to stand in the position. But men will have 20% and be like, "Oh, I'm the best. I'm the only one that can do this job." So I think it also has to do with our gender, in the way that, men and women can sometimes respond to challenges. Women want to we want to have the 100% picture before we feel like we're worthy to step into it, and that hasn't served us well at all, because nursing is a female dominated profession. And so some of that spills into our workplace.
That's so true. If I would have had more time, I would have studied Ohio State law. I would have gone back to school and got a minor in political science. I mean, I would have thought I had to do all those things, but the kind of blessing of the state house and how this works is this seat opened up and you got to put your name in the next month if you're running. And then when you get elected, you got to do it. There was once I put my name in there, the train was moving and I wasn't able to do my usual, oh no, I'm not enough. And I get here and these people are just people. I mean, and so many of the things, like you said, the little things, sometimes some of the good I've been able to do as in the super minority is small things and made small bills a little bit better for average people. And those little changes wouldn't happen without me here. And I don't have to take credit for them. That's something, a lot of people in politics want to take credit for everything, want it to be their bill with their name on it. And we're used to not having that. And so I'm fine with it being your bill and your thing. Just, can you stick this little thing in for me? And, and I don't have to say it was mine, but I just know I helped people with that change. So we do that kind of stuff all the time too. And our egos are okay with that because we're not there for ourselves. We're there for the mission. Yeah.
That's wonderful. Thank you for sharing that. So we are going to, and I feel like I can delve even deeper into your journey and policymaking and all that jazz. Maybe we'll take that offline. But I do want to, be mindful of our time and kind of transition into talking about these media stereotypes, right? We chatted before and you spoke about how nurses need to break free from that angel, hero, sex symbol kind of stereotype. First of all, why do these images exist and how do they impact the profession? Because we know they impact the profession negatively. So, can you talk to us more about that, all these images?
Yeah, I think it's why I didn't think about going into nursing. I didn't want to be a hero. I didn't want to be an angel, and I definitely was not a sex symbol. So I'm like, I'm not a nurse.
Like
Like,
we don't have time to be sexy people.
no, we got too much work to do. Um, so, I think that one thing, it turns away a lot of like people who would be great nurses, because I meet so many nurses that are nurses because their mom was a nurse or their aunt was a nurse, or which is great for those people know what it really is. Like those of us who don't, I didn't have nurses in my family. I just know what I heard. And I was like, nah, that's not for me.
Yeah.
So I think it one negative impact is that it narrows down the people who are going to be interested in going into that field. And then, the other thing is how other people interact with us. I think patients who don't, or people in community who don't have a lot of experience with nurses, they might believe that. Patients who've been in the hospital a lot always love their nurses. So they know the real thing. But just how we're viewed, how people approach us, I think it holds us back. And during COVID, I felt that a lot. Like I felt not the sex symbol, but like we were these heroes that like, healthcare heroes, and bring cookies for your heroes or bring a pizza party. And like, we're not heroes. We're like professionals who are educated and doing a job. Like it just kind of something about the words heroes and angels makes it feel like we should be okay with less than. We should be okay with not the best working conditions, with not safety at our workplace, with not all the equipment we need, because we're an angel coming down to do this good work. Like, no, we're professionals who deserve a safe working environment and deserve to be respected and not injured at the job. And so none of us are doing this to be a hero or an angel. We're doing it as our profession that we trained and, studied. And it's weird because those sound like good words. Angel and hero sounds like good words, but they almost diminish what we do and make it less professional, I feel like.
Yeah, I hear you. A lot of people have said that when we turn nursing into this angel image, that what we're doing is we're saying that we can take just any sort of treatment, just like you've alluded to. But it also says that we don't need to take care of ourselves because like Superman doesn't take care of himself. Like nobody asks Superman, whatever, how do you feel? Like, how did you feel today about rescuing that kid from the burning building? Nobody talks about that. He just gives and gives and gives and doesn't get to be given back because we have chosen this path of martyrdom and that is our mandate. And so I think that it does that. But like you said, it also diminishes our respect and our value and the side to us that are scientific, that have, been researchers, that are scientists, that are business owners, that are Congress women or men. It takes away that aspect of who we are because we're just seen as this single dimensional, role or image. I mean, I think that people mean well when they say that, but it doesn't really do us a service by being portrayed in that light. So thanks for saying that, and thanks for seeing it that way, because it kind of validates my own feelings as well about it. Okay, you do a whole lot of things. Are you still teaching graduate students? Oh my goodness.
The problem is that I love everything I do. Everyone's like, "Are you going to give up this?" I love I cannot give any of it up because I love it all.
That's amazing. Okay, so I know we are transitioning to the media portrayals part, so I'm going to hurry up and do that. Do you watch any shows, or have you ever watched any shows? I know you're kind of busy these days. And if so, what is your opinion about the way nurses are portrayed in media? I think this kind of ties into the question we just talked about. So, yeah, you can talk about a show
Yeah,
specifically.
you know what? This is like a long time ago show, but I
Mm-hmm.
feel like it was when I was like thinking about being a nurse. And
Mm-hmm.
so it was when I first kind of paid attention to nursing in media was ER. Remember the old ER show? And
Mm-hmm.
remember that, I don't even remember her name, but the woman that was a nurse because she was a
Mm-hmm.
nurse to work her way through medical school.
Oh, yes. I
And so that's how she was paying for med school. And like,
remember.
I remember, I think that was, I should have looked up what year that was, but I feel like that was around when I was going back to school to be a nurse.
Yeah.
And I was like, why would you go through nursing school to become a nurse to work your way through medical school?
Right.
Like, it's not like you're a mini doctor. Like,
Yeah.
it just was such a weird, um, portrayal as like a less than a doctor wanting
Yeah.
to be a doctor kind of
Yeah.
role. So that was one that I thought of that I hadn't thought of in a while. And I
Mhm.
was like, that was a weird portrayal.
Yeah. Carol Hathaway is her name.
Yes, yes. Good job.
Trying to think, I'm like, what is the name of that? Yes,
I
Carol
know.
Hathaway. She was that character from ER. But yeah, it's always, especially when I've seen that with male nurses. And they're like, why are you doing this? You know, whatever. And he's like, well, I'm just doing this until I can get into medical school. And it's kind of justified that, oh, okay, well, I guess you are going to be a doctor. So it's okay that you're doing this for now, which is really sad.
Yeah.
Because I think people are still discontent with being nurses. And I feel like, I mean, you can be a nurse and then go ahead and be a physician. That's perfectly fine, you know. But I think that there are other professions that you could do. Like nursing is like a huge profession by itself, you know. That's
Yes.
a lot of people's like stopping point to do
And it's a
that. And yeah, and then to go and be a physician, it almost seems like nursing was not enough, you know.
yeah, and it's a
Mhm.
different position. It's not a step to being a physician is not
Exactly.
beyond a nurse. Like
Yeah,
it's a
exactly.
different
It's two
position.
different
That's
professions altogether. But yeah, thank you so much for sharing that. We're gonna play our game. Are you ready?
I'm ready.
Okay. Alrighty. Sorry, I was a little nervous this entire episode. I don't know if you noticed, but
No, don't be nervous.
I'm in front of royalty.
Oh my gosh, no.
So, okay, well, let's go ahead and play our game. I'm going to shake my jar around, pick out a category, and then you have to come up with the plot of a show, movie that features a nurse. You ready?
Okay, I'm ready.
Let's do this. Let's do this. Alrighty, here we go. Wow. Okay, so this is a political drama. How fitting is this?
This is perfect. This is exactly what I should write.
Let's do it.
All right, so a political drama with a nurse as the lead.
Mhm.
So I would have her be a strong. Well, okay, let's have her. Let's take COVID and make it a little different. So let's have COVID starting. She's a nurse in a hospital and a pandemic hits. And she's, on the front line and then makes the health policy connection and starts getting interviewed by news and putting herself out there to be the voice of pandemic response. And then let's say she becomes like the Florence Nightingale lead of like the country's response to the pandemic, and she gets everyone on board with nursing and then advances her political career from there. She becomes like head of health and human services and then
Cool.
on the president's panel and
Oh,
gets us all back to like looking at health in a really good way. How about
yeah.
that?
Wow, I love that. That sounds like your story.
Yeah. She's an
That was
empowered, strong nurse who sees
Yeah.
who sees the path that nurses need to take and gives a different view of nurses. Super
Yeah.
smart,
Yeah.
approachable,
Yeah.
nice, respectful, kind, but
Yeah.
like smart and leading us in the
Yeah.
right way, telling people what
Just
they
like
got to
you.
hear.
Just like
I don't
you.
know.
Just like you, Representative Baker. Yeah, this is wonderful. Thank you. If that ever airs, ABC, if you air that episode, we're gonna we're gonna come collect our money.
Heck yeah, we
Thank
claim
you so much. Thank
it.
you so much for that. Where can people connect with you?
Oh, great. So I'm on all the social media. I think my tag on everything is REP, Rachel Baker.
Mhm.
Except for Facebook, I'm Rachel Baker for Ohio. They wouldn't let me be Rep Rachel Baker here. So, but all the other things, you should be able to find me. I try to do kind of weekly updates on what's going on in Ohio and policy, and keep people engaged and informed. And anyone, feel free to reach out to me. I would love to help anybody who's interested in advocating or running for elections and getting more involved.
Thank you so much for that. And if you could recommend a guest to anyone to be a guest on the show, who would it be?
Oh, that's a hard one. Let me think. Who?
Lauren Underwood is like in the
Oh,
same.
yeah. That almost came out of my mouth. That's who I would want to talk to.
Okay.
I mean,
Yeah.
she's doing this on a national level,
Yeah.
and she's been so impactful. I would love to talk to her.
Awesome. Awesome. Thank you so much. Yeah. So I think I might reach out to her,
You should
Congresswoman
do
Lauren
it.
Underwood. Yeah. Thank you so much. This has been an amazing, amazing episode. Thank you all so much for tuning in to the Nurse on Purpose podcast. I hope that you guys have gained some valuable insight into the world of nursing. Let us keep leading. Let us keep advocating. Together, we can change the narrative of nursing. Until next time, bye-bye.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.